Recently at Hovnanian School in New Jersey took place a special presentation by psychiatrist Marianne Tateosian on the subject of bullying, how it can affect your child. The event was co-sponsored by APO. Event began with welcoming remarks by principal of Hovnanian School, Shaket Ashtian, who spoke about the importance of better understanding the problem of bullying and taking steps necessary to protect our children from this ever-growing threat. Dr. Tateosian is a board-certified in adult as well as child and adolescent psychiatry. She received her medical degree from Nova Southeastern University and completed a fellowship at Montefiore Medical Center. Dr. Tateosian is affiliated with Northwell Health Physicians Partners and is assistant professor at Hofstra Northwell School of Medicine. With the audience mainly comprised of parents of the students of Hovnanian School, Dr. Tateosian presented an engaging and informative PowerPoint lecture. She defined the meaning of word bullying and described the statistics of number of children being bullied in the United States.
So let's look at some of the numbers so we know what we're dealing with. So about 20% of U.S. children, that's 1 in 5 children, are frequent bullying victims. So this is up 10% from 2008 studies. So these numbers were from 2013. In 2015, the numbers have gone up to 33%. So now 1 in 3 children is a victim of bullying. So according to the National Education Association, about 160,000 children every single day miss school because they're afraid of being bullied. So whether they're afraid of being physically bullied, verbally bullied, attacked somehow, they do not go to school for fear of being victimized.
Dr. Tateosian discussed the risk factors of children being bullied or becoming a bully based on recent studies. She then identified 4 different types of bullying amongst the children of ages 13 to 17.
So there's 4 types of bullying if you look at it. So the first kind is verbal bullying. So anything that involves saying or writing mean things is classified as verbal bullying. This includes name-calling, taunting, inappropriate comments, threatening somebody. The next thing is social bullying, or what we call relational bullying. So this involves hurting someone's reputation or somebody's relationship with others. So this can include leaving somebody out on purpose, telling other children not to be friends with somebody, spreading rumors about somebody, embarrassing somebody in public. All these things fall under the classification of social bullying. The next one is physical bullying. So physical bullying involves anything where somebody lays a hand on somebody else. And the last one is cyberbullying, or the use of social media. So this is a growing trend that we're seeing now. This is what we're seeing bullying evolving into. So this involves anything such as sending mean messages or threats to a person online, hacking into somebody's account and pretending to be them, sending threatening text messages, emails.
In an important information to the parents, Dr. Tateosian discussed ways of parents to protect their children from being bullied. She suggested for parents to look for warning signs, including their children being upset after using computer, being secretive and protective of their mobile devices, and changes in children's mood, behavior, and sleep patterns. In an emotional part of her presentation, she talked about mass shooters in schools and colleges being victims of bullying. She also discussed dangers of suicides in children that are being bullied.
How many school shootings have we seen in the past few months? The 2 Columbine shooters were both victims of bullying. If you read one of their journals, he said, one of the quotes was, "Every day you walk by me and you never ask me to hang out, you never ask me to go anywhere." So both of them were the victims of bullying. And unfortunately, what I deal with every day in the emergency room when I see children is suicidal ideation or suicide attempts. So in our emergency room, in the psychiatric area, we see about 3,000 kids a year. That's a lot.
Dr. Tateosian also presented a practical demonstration using one of the children in the room. The purpose of the demonstration was to explain in simple and playful way to the kids present at the lecture not to share images they don't want others to see with their peers and friends online, images that can later be used by others to cyberbully them. The lecture ended with an engaging Q&A where parents had an opportunity to ask Dr. Tateosian questions about ways they themselves can protect their children from the dangers of physical and online bullying.
I thought this was a very informative event tonight. Most important for me was understanding that proactively having a conversation with my children about the topic of bullying could be beneficial down the road. Proactive approach versus a reactive approach. Also, she gave a lot of statistics that were, again, very informative, how the percentage of cyberbullying is increasing tremendously due to the fact that kids have access to social media and phones and tablets at a much younger age, and how it's easy for them to hide behind the screen versus confronting the people that they're bullying. And lastly, what I thought was interesting was how kids are losing the art of communicating with one another and that face-to-face interaction because of the social media and because of the access to this modern technology, if you will. So great event, wonderful job by the Hovnanian School putting this together, learned a lot.
The feeling of family at Hovnanian School is incredibly important. And so that's the tool that we can use to help the children realize that that as a community we can't have this kind of bullying. However, what family exists that doesn't have this kind of tension in it? There's arguments, there's fights. That's what a family does. We have these arguments and then we come back together and we resolve our issues. That's the whole point. We need to be able to resolve these issues. We need to be able to address them, not eradicate them. They won't ever go away forever, and that's not healthy. It's not healthy for them to be gone, because with every one of those fights we build stronger bonds. We build stronger family. So the point isn't to get rid of them, it's to know how to deal with them when they do pop up. Children are human beings. We're all human beings, and we all need to know how to learn how to interact with each other. It's going to happen. We just need to figure out the best way to do that.
This presentation was one of many important lectures organized by Armenian American Health Professionals Organization to better serve Armenian community.